Hi, I'm Dr. Cordelle Ofori. I'm a public health doctor, so I'm a consultant in public health medicine based in Manchester. Today I'm going to be watching a debate that Pi Radio did about the COVID-19 vaccine and commenting on it from my professional perspective, and also giving some confirmation on the facts about the vaccine.
There wasn't enough time to really develop and the research.
But if you were to take the mRNA ones, then that is experimental.
Why
it's
is
never
that
been used before.
In terms of whether it's experimental or not, it's not actually. They were working on this technology for years and years and years before COVID-19 existed. And once the pandemic happened, they just then quickly started to use that technology that they had already been working on to produce this vaccine. And the benefits of the messenger RNA approach to producing a vaccine over the other ways in which we've produced vaccines in the past is that it's much quicker, so you can produce it really quickly, which is what we needed in this scenario. And also, you're not giving anybody a real vaccine, whether it be a live vaccine. So there's some vaccines we give where you're actually getting a bit of the virus that causes the disease, or what's called an inactivated or dead virus vaccine, if you like, where the virus has been killed in order to give it to you, or a little bit of the vaccine of the virus is also used sometimes. And all of those processes mean that not everybody can have it, and also it really takes a much longer time because you're working with real viruses rather than producing that bit of genetic code. So there are lots of benefits to doing it in this way rather than the ways in which we've used in the past.
So mRNA is a completely different vaccination deployment system.
Right.
So say if this was a real pandemic, why would you not just use the original vaccine systems that we've had forever? Why test out this new mRNA system?
It's not, so obviously that technology is not...
Does gene alter as well? It's a medical device. It's not even a vaccine. It's a medical device.
It doesn't alter your genes. It doesn't enter the nucleus because your DNA is in the nucleus and it doesn't enter the nucleus. It's just a gene instruction. It's genetic instruction. So you're asking why they're using that technology rather than because it doesn't work. That's the technology that works, that they've proved that it works.
In terms of the type of vaccine, so they were talking about mRNA, and I like the explanation that the lady in the video I think is almost better than mine in terms of explaining what mRNA is in terms of genetic instruction. So all messenger RNA, ribonucleic acid, it's like a little globule of fat that contains a little bit of genetic code, and what that code does is tells your cells in your body how to make a particular protein. That's all it does. It's not DNA. It can't interfere with your DNA in any way. It can't interfere with your genetic makeup in any way. It can't affect the genetic makeup of any future children you may have. All it does is tells some cells in your body how to make a protein. And in the case of the COVID-19 vaccine, it's telling the cells in your body how to make something called a spike protein, which is a bit of protein that's very like the protein that's on the real COVID-19 virus. So once your cells make this protein that's very much like the spike protein on the real virus, but not the real thing, your body then sees this, detects it, and generates an immune response. So you produce antibodies to this protein, which means that over time, if your body's ever exposed to COVID-19, so if you come across anybody who's had it, who could potentially pass it on to you, you've already got antibodies. Those antibodies deal with the virus straight away and stop you from getting it. So that's how the vaccine works.
To call it experimental would be to say that someone has come up with it and they're testing it. They're testing it as they're giving it to people, which is not the case.
That is the case. Do you not know it's in trial till 2023?
But they've gone through trials already.
No, you are part of the trial if you take it. The trials don't end till 2023, so it's experimental.
It's been approved though.
If we're waiting to find out if it actually works until 2023 when the trials are over, then we can't say that it's safe and effective.
But then we can say that for a lot of other vaccines, like say for example, if there are other vaccines that were made in the past 10 years, we can say, oh my God, like it's still technically in the trial phase because we don't know how this vaccine is going to affect us in the next 60 years.
No, it would have done.
Like there's so many vaccines that we don't know the long-term effects of.
No, they would have had 20 years at least, decades and decades. Before you inject a vaccine into any pregnant woman, child, there would have been decades of research.
Decades of it, yeah, but still, that's
not even a full year yet.
The vaccines have been through clinical trials, and actually there were lots and lots of different candidates for the vaccine, if you like. So all over the world, scientists and researchers all over the world stopped what they were doing to focus on developing a vaccine because it was a worldwide emergency. So an immense amount of work, unprecedented, never really been seen in the same way before, went into developing a vaccine as quickly as possible. Once some candidates are found, they will go through laboratory testing first, and the WHO, so the World Health Organization, will say that for any vaccines, so not just COVID-19, but for vaccines in general, for every 100 different types that goes through laboratory testing, only 7 of those will make it through that first phase, and that's before it's been anywhere near a human being. Only 7 out of 100 make it through that phase. It then goes through clinical trials where it's tested on people who have volunteered to be part of the trial. And that did happen for all of the vaccines that have now been approved. So it went through the various phases of trials with people first to check that it works and also to check that it's safe and doesn't have any side effects that would outweigh the benefits of the vaccine. So all of that happened. What then happens is even more regulation. So every country will have its own regulatory body that then looks at the research evidence from the companies that have produced a vaccine and from the independent research, and will look at that and weigh it up for the population of their country and make a decision for the people in that country. So in the UK, it's the Medicines and Health Regulatory Authority, the MHRA, and they have approved 3 vaccines now for use in the UK, the AstraZeneca one, Pfizer, and the Moderna vaccine, and they've all been through a trial. So that's the first thing to say, is that they have been through really thorough research and a thorough approval process. And it's the same process that we would do for any vaccine. It's been done more quickly because this was an emergency.